How is everybody doing? Happy Thursday today, Dr. K, for our sunset musings. Okay, so let me show you this. This saguaro is fairly short comparing to all the other ones. So what that means, I have to be on the lookout for these amazing fruits, because those are reachable with a little stick. If you have the option when they get red before the birds eat them. Oh my gosh, I'm hoping I can collect a few of those. Not only are they very nutritious and healing, they are delicious. I just got reminded, to share with you. I have these drops that are from, I think, the company called Boiron. They come in boxes and in a package of 5. These little Optique drops. And I like to carry them on me because they are sterile. There's no preservative in there. They're homeopathic. And you just open this up and you can drop it in your eyes. And what happens in these windy conditions, especially with these allergies being so intense for so many people, when we rub our eyes, it makes it worse. So it's nice to have something like this to flush the eyes, boom, boom, a few drops, and we're good to go. So those are available. Sprouts, Whole Foods, or in our office, either one. So that's something I just remembered. Always have them on me in my pocket. So always the good stuff in my pockets. So today, where do we begin? Not many clouds. However, it's still going to be a beautiful sunset. When I was doing my immune system Monday musing for you last Monday, I was saying, we're not going to focus on the COVID topic because there's so much, it's never ending. It's like we get lost in there. However, there's few things I do want to mention and point out today, just like a recap from everything that I have witnessed today, that some of the things I'm surprised about, some of them are very empowering. A patient came and he shared with me that his wife went to a GYN doctor who she sees once a year for check-in and for prescriptions and ultrasound and all that, and they informed her that for her next visit she has to have her COVID-19 vaccination or she won't be able to be seen. And he said, she had it with them in a nice way. And she said, no, she's not doing that. And they asked her, why not? And she said, well, do you have an hour? I'll explain to you why I'm not doing that. Of course, they didn't. And so she said, well, thank you very much. If that is the case, I am going to find another doctor. And I thought that was so nice, very empowering. But that is what will hopefully happen. Then instead of those who don't believe in getting vaccinated, that there will be a free choice to come to somebody that can honor that. Same thing I'm looking for. If somebody can put together a cruise anywhere, but in particular to Alaska, that is a cruise that is not a vaccinated cruise, meaning it's not required to be vaccinated, sign me up. So I guess we'll just have vaccinated and unvaccinated, events. Hopefully that'll be the case, unless you can be invited to have a multi-share event. I suspect that's what will happen, because I am sadly have to say that I'm seeing more and more patients that are struggling with the vaccinations. Oftentimes worse for those who had the COVID infection and then they got their shot, especially the second one. A lot of their symptoms came back, which is being told that that's a good thing, but I have not seen them actually recover from that. So I am seeing, unfortunately, these ozone treatments and hydrogen peroxide IVs and high vitamin C's, I wish they were available for people when they got ill, because I'm seeing two things. I'm seeing people are finding about ozone, many months post-COVID infection, and luckily the ozone is able to help, or the other IVs, but they're finding about it so late instead of being able to do it right there and there at the beginning, where it would have really helped them to take care of that. Same thing with the vaccination. It's like it's bringing things up that are lingering in long term. So I'm suspecting we're going to see more and more of this, and we're actually, like traveling to Europe. They don't ask about vaccination card for most. They ask to have a COVID test. So that's a good thing. Like a lot of the world is actually seeing that the vaccination is not preventing the COVID. There's a Lancet study that actually was published. It's like 1.3% is the highest as far as prevention right now, and it's being actually taken in consideration as far as the world travel goes, and countries are asking for the test, not for the vaccination card. So that in a way is a good thing, because we can really stay true to what one believes in, right? As we watch the sunset. So I was very happy to hear about this beautiful soul just, honoring her own beliefs in her own body and deciding to just find physicians that can support her in what she believes. So I think that's what we need to do. Remember, I was saying this is a huge opportunity for internal empowerment, for speaking up. And then there's ways to speak up when we're defensive that don't come out as powerfully. And then there's a way of speaking up from our deep resolve and deep truth that are being carried, kind of on the wings of compassion. And they tend to be so much more powerful as far as being heard. So I always want to remember that when sharing some uncomfortable truth with others, or speaking mine, and they're on a different, in a different camp when it comes to their beliefs. I'm not asking them to believe mine. I'm just asking them to honor and respect where I stand. That's all. And after the sun sets, I have one more quick share. But for now, thank you, beautiful sun. As always, sometimes we don't really remember, but without you, there would be no life. So, just kind of wow, puts me in perspective when I think about that. So, thank you, thank you, thank you. Take some deep breaths. It helps to reconnect the nervous system, reconnects the two hemispheres of the brain, helps to settle down our nervous system, and ultimately what it does, it allows us to be more present to the moment of the beautiful sunset. I just saw somebody, an amazing being whose goal is to ultimately, have a better lifestyle, take care of himself better, and stop smoking. And sometimes the easiest thing for us, instead of going cold turkey on everything and then being so harsh on ourselves, like, oh, I failed again, is to go slow. And what we will notice is, as we start replacing the good things and the nutrients, even something as simple as taking a deep breath. Let's say if there's smoking involved, without the cigarette, just focus on the breath and take the moment, because oftentimes what the smoking does for the mind and the nervous system, it creates a moment of like a little meditative moment where no matter what I do, I can take a break, right? And so that break allows the nervous system to just reset for a little bit. So if I can do that consciously in between at any given point, just simply by breathing, remember the breath, taking oxygen, and on top of resetting the nervous system, I'm bringing more oxygen in, which ultimately is gonna add, every molecule of oxygen is gonna add health into my being and help the lungs feel better and carry more oxygen, even if the smoking is involved. That's a good start before moving forward, doing many other things to help to change that. I've spoken to my beautiful teacher, and I thought, I have never considered myself being on the front line when it comes to this pandemic, because I'm not in a hospital treating, massive amount of people being sick on ventilators, seeing the unseen and unspoken, and it's just like, can't even imagine that. And I know I made a video about that, and just my heart goes out to everybody, and my deep gratitude goes out to everybody who has been doing that for so many months now, more so now sometimes than ever. And I had a share from the same patient with his wife that was, as he was driving to the office, there was a nurse sharing on, I think it was a PD podcast he was listening to, and she said that they are protesting the hospital administration against being forced to get vaccinated in order to work at the hospital, because saying everybody is seeing what we are witnessing here with patients coming in sick after the vaccinations, and you cannot ask us to get vaccinated. You cannot ask us to get vaccinated after we're witnessing what we're witnessing. And again, once again, a profound truth being spoken, and hopefully it'll be heard. But what I realized, there's a front line that's a front line, and then there's a front line that's a back line, for lack of better words. And what that is all the physicians and other health practitioners and anybody, nurse practitioners, you name it, seeing what I'm seeing, which is patients struggling with still post-COVID symptoms, unable to find treatment, or not given the treatment available to them to help them deal with and support the immune system to finally eliminate and get rid of the virus and support the inflammatory process in the body that's still going on, and or vice versa. I'm seeing so many people now with their high hopes going to get vaccinated, and then getting worse or getting symptoms that are just lingering, and nobody can do anything for them, like IgA vasculitis, just okay, let's just wait and see. It's not so. It's like a different front line, and what I mean by that, I just want to honor everyone going through that, and I believe that it's something to be spoken about, because what it does, it creates a chronic high level of stress on the mental emotional field of our organism. Like for me, what it is I haven't really kind of honored that until recently. It's like, I'm not really at the front line, I'm not the one to go home, have to take off all my gear, wash all the laundry, shower everything, not see my family. But this is more like a chronic kind of gaping wound, where I see the hurt being done, and the people struggling and losing hope, and being, literally like, I don't know what I'm gonna do. Like, am I gonna get better? And it's like, for me, knowing that something else could have been done right off the bat, or knowing that, there's more available than the vaccine if we really look at the big picture, and then having to see like, oh my gosh, like all these things have to be done now to even support them going forward. So it's like it can be easy to get into this hopeless place. So what I have noticed that I want to share with anybody who is in any way remotely affected by this, whether it's your significant other that's in that same healthcare position, or you're in, or whether you go to your physician and sometimes they are not really sure what they need to do right now, so they decide to only see vaccinated patients because there's so much high stress on them that they are just making decision that's the easiest for them, and for their staff. It's because the level of stress and pressure in the medical field and the level of unknown has been so vast. What happens oftentimes, we have to push it away in order to go and do and see the patients and do the work that I need to do. Is if I'm not conscious, I kind of have to go, okay, there's this big cloud of pain and, in a way, trauma of humanity, really, but I'm not able to deal with that right now, and I don't even know. Let's just leave it and do. But it builds up and it piles up if we don't consciously address this, or at least where I go, okay, wait a minute, there's this high level of stress, anxiety, like I have to really honor that, and I have to show up with more compassion for myself and then for others and the decisions that others are making, whether they're physicians or whether there are patients, and then respect that, because understanding that they are influenced by this big, energetic, unknown stress field, and just absolutely do the best I can to stay present, just like with the sunset. That's what happens for me every day. Just like stay present and realize that I'm doing my best, the best that I can, and so is everybody else, and I'm not the one to judge anybody else's. All I can be is inspire people to follow their inner guidance and their empowerment and speak their truth and stand for it from a place of love and compassion. And if they're not able to understand that they are just simply not able to, and if they react and get upset, can I stay in my truth and my compassion and understand that they're going through something right now, because the level of stress is almost like, we have had stress as a humanity, and then it went up to like massive, COVID pandemic. It's kind of calming down, but it's becoming to be more chronic in a whole different way. That's more difficult to kind of put a finger on. So I just want to encourage us to understand it's there, see it for what it is, and be there, the more present with ourselves, which will really help in the big picture. It's like these anchors, like if you have like this big storm, there's like the anchor in the middle of the storm. So almost like, can I be that? So that's what I'll leave you with for today. We had a beautiful sunset. Thank you so much for sharing, and I will see you tomorrow. Take care. Good night.